Good afternoon. I'm just going to do a quick whistle-stop tour of 270 years of innovation at the Rotunda Hospital. So the Rotunda Hospital is the oldest working maternity hospital in the world. It was established in 1745 and moved to its current location in 1757 on Parnell Square. It opened there and has subsequently never closed. And the vision and innovation that underpin the foundation of the hospital has continued to this day, allowing us to deliver the best quality of care to generations of women and the over 800,000 babies that have been born there. So the hospital was founded by Bartholomew Moss, a surgeon turned man midwife. And during this time there was a large population of poor women flooding into Dublin from the countryside, and many of these women were pregnant. And there were deplorable conditions for childbirth at the time, with few skilled birth attendants, and this resulted in very high maternal and infant mortality rates. And there were no hospitals dedicated to maternal care. And Moss felt great sympathy for these women, partly because his own wife and child had died shortly after childbirth. So he set about to make a change. He leased the original Lie-In Hospital in what is now Fade Street in Dublin, but he was a man of great ambition, and he set out to establish a teaching hospital specifically dedicated to maternal care and a purpose-built hospital. He leased a 4-acre site north of the city, which is where the hospital now stands, and he straight away employed a gardener to landscape the grounds into pleasure gardens, which he charged the rich people to enter. He can be considered the pioneer of corporate entertainment. He ran lotteries, he held concerts in the hospital grounds, all to fund the building of the new hospital. And when it was built, it was the first hospital dedicated to maternal care in Europe. So possibly one of his greatest achievements is the beautiful Rotunda Chapel, which still is a great historical site today. So some of the early, and this is the original site of the hospital with the gardens that originally spread all the way to the back of Parnell Square, to where now the Hugh Lane Gallery is, with the original Rotunda building on the side where the hospital takes its name from. So some early innovations in the actual hospital itself was the layout. It was laid out in a series of smaller wards, where at the time most hospitals were laid out in much larger wards. This likely contributed to it remaining relatively free from some of the epidemics that were rampant in other hospitals at the time. And also in the mid-1800s, new hygienic measures were enforced to control the epidemics of puerperal fever. And this included the sterilisation of the labour ward, which now would seem obvious, but it was a quite innovative thing to do at the time. And this was then extended into the neonatal section. The neonatal and paediatric service opened in 1927, and they also introduced infection control there and reduced neonatal mortality in infants by half over a couple of years. The Rotunda Neonatal Service has consistently cared for the greatest number of very low birth rate and critically ill neonates per annum on the island of Ireland. So the Rotunda has continued to be a pioneer of new techniques, procedures and research in the area of maternal and neonatal care. It's been first nationally to introduce C-sections, ultrasound scans and epidurals. So now we have roughly 9,000 births per year, and as a tertiary referral centre with 1,500 NICU admissions, 40% of our patient population are now non-Irish. So we will continue to provide specialised services to the most vulnerable populations in our community. And some of the ways we do this is by having some specialised clinics. So one such clinic is the Dove Clinic, or our Danger of Viral Exposure Clinic, and this is an dedicated infectious disease clinic. It would link in very closely with the Mater Hospital Infectious Disease and also the Centre for HIV Medicine in Crumlin. So since this clinic opened in 2001, we've seen over 3,000 women have been booked for antenatal care with the clinic. And this would include about over 550 HIV positive women. It is a truly multidisciplinary team that would look after these ladies. And our new figures, which for 2014, there was 18 HIV positive women gave birth to 18 babies, none of whom tested HIV positive. Another unit that was pioneered in Rotunda was the sexual assault treatment unit. and this was the first of its kind in Europe. It's a national centre for evaluation of adult sexual crime. It would provide holistic support also to its victims via linking with the Garda Síochána, the Forensic Science Laboratory and the Rape Crisis Centre. It also offers treatment options such as emergency contraception and prophylactic medications to prevent the spread of STIs. So our figures would show that we would consistently have between about 250 and 350 people attending the Rotunda Treatment Centre a year, and that would amount to about one person a day turning up as a result of sexual crime at the Rotunda. And we're open 24/7. So as well as our specialised clinics, we would also offer a specialised surgery. And one such technique is surgery for twin transfusion syndrome. And this is a complication in multiple pregnancies that share a placenta. And sometimes when the babies share a placenta, their blood supply is also shared, and the blood can flow between the twins disproportionately. And this can result in one twin becoming growth restricted, while the other twin receives too much blood and goes into heart failure. So untreated, 90 to 100% of babies would die from this condition. But in 2006, the National Fetal Laser Programme was established in the Rotunda to address this condition. And so in this procedure, a fetoscope is put through the abdomen and into the placenta, where the abnormal vessels are targeted and the blood flow is corrected. And this then will allow the better growth in the smaller twin, while also taking the pressure off the heart of the larger twin. So since it was established in 2006, we've had over 100 procedures carried out. Both babies have survived in 47% of the cases, and at least one in 75%. And these are two babies that were one of the first to undergo the procedure. The Rotunda also supports initiatives that reduce the risk to our patients, and pregnant women are at increased risk of developing blood clots, and in the developed world, VTEs are the largest cause of maternal death. So it's very important to assess a woman's risk for developing a VTE and treat it appropriately with low molecular weight heparin. So traditionally, especially in a busy environment like the Rotunda, there's very low poor compliance in assessing women. So a multidisciplinary team came together in the Rotunda and developed a tool to streamline and improve risk assessment, and they call this tool ThromboCalc. So this is just a screenshot of ThromboCalc. A midwife can fill it in, and it will generate a score which will indicate a woman's risk of VTE. It will also indicate if thromboprophylaxis is necessary, and also at what dose. So it was implemented in the Rotunda in 2014, and over 10,000 women have been assessed. And 95% of patients now undergo a VTE assessment. And the innovation and ambition of this was acknowledged by the HRB Healthcare Innovation Award in 2015. So rapid molecular diagnostics has become a game changer in the treatment and management of people with suspected infection. So Rotunda invested in this Gene Expert platform, which is a cartridge-based PCR technique. And basically you can get a result on infections in 2 hours, rather than waiting 2 to 3 days for blood cultures to grow. It can be used in a busy lab by multidisciplinary scientists. So we've introduced rapid influenza and MRSA testing on a 24/7 basis, and it's also being validated at the moment for interpartum Group B strep testing. So this has had a significant impact in improving patient care through optimising antibiotics soon after admissions, and also reducing hospital stay. Another innovative device on the neonatal side is our echocardiograph. And this is a novel technique to assess cardiac function in real time. So it's advanced real-time heart imaging, and has now been used for the first time in preterm infants, so the complicated twin cases and congenital diaphragmatic hernia. And it can be used at the cot side and is very effective. And we've also moved on from this to now try to use the same machine to look at the fetal heart. So it's a speckle tracking method, and can look at normal, the heart of normal fetuses, and also fetuses that are at risk of growth restriction and preeclampsia, etc. So this has led to more accurate prenatal diagnosis of heart conditions in babies. So we don't work on our own in our research projects. We work with many collaborators, and we're the home of Perinatal Ireland, which is an All-Ireland network, encompasses 7 maternity hospitals and their associated academic partners. It provides infrastructure for research and has access to a cohort of over 50,000 births per year. So 2 of the big studies that Perinatal Ireland have undertaken has been a national twin study, which recruited over 1,000 twin pregnancies, and it informed national guidelines on the management of twins and timing of when to deliver twins that are growing at different rates. The other larger study they did was the Portal study, which was a study on growth-restricted fetuses. And in this study we recruited over 1,200 patients and then informed national guidelines on the management of intrauterine growth-restricted pregnancies. We're also a site for many clinical trials. We're a site for the first drug trial in pregnancy and one of the first neonatal drug trials. These are trials that address key maternal and neonatal health challenges such as preeclampsia, gestational diabetes, and neonatal trials also. So thank you very much. And